federal appeals court has ordered a temporary stop to President Biden's vaccine mandate for large companies. A three-judge panel granted the stay this weekend, saying there are grave statutory and constitutional issues with the mandate. This comes after several Republican-led states filed legal challenges against the rule, including here in Indiana. It would require U.S. companies with at least 100 employees to be vaccinated against COVID-19 or submit to testing weekly. That mandate is set to take effect January 4th through the Occupational Safety and Health Administration. So far, the White House has not commented on this latest ruling. We'll continue to follow it.
One goal of the vaccine is to keep you out of the hospital if you do get the virus. The last year and a half, hospitals have been stretched, to say the least. Doctors and nurses are exhausted, sometimes to the breaking point. And Dustin, you got a very unique perspective of this.
Yeah, I really did. I've been talking with the men and women on the front line who showed me what they are still facing every day. Inside the ICU at Community Hospital South, Marcus Guajardo is fed up. Not with the nurses he supervises or the patients under his care, but with a virus that won't go away.
We see death daily. We see it all the time.
On this particular day in late September,
it's very important that you spell it correctly.
As schools returned to in-person learning and sports fans were back in the stands, life for most of us seemed to be almost back to normal. But at the hospital,
we are still in a fight.
11 of the 12 ICU beds were full. 8 of them COVID patients.
We're exhausted mentally, physically, just exhausted.
What can I do to help you get out of this room?
18 months into the pandemic, his nurses still work nonstop and often see little relief.
They can't have a family member in there with them. They're alone. And
you're it.
Yeah, we're it. So we're playing nurse, we're playing family member, loved one, kid, chaplain sometimes, dietary, doctor. I mean, we play all the roles.
I lie in bed awake at night just thinking about what the next day is going to bring. What can I do to help my staff? What can I do to help the patients of the hospital? And how bad is the next day going to be for us?
Managers like Marcus are focusing more than ever on emotional assistance for their employees. They're also encouraging frontline workers to take time off. But hospitals, still packed with patients suffering from COVID, find themselves facing a potentially catastrophic symptom of their own. Some nurses are so burned out, they're considering taking off and not coming back.
She told me that she has seen too much death, that she loves being a nurse, she loves being in healthcare, but she had to do something else other than being an inpatient nurse because of all the death that she's seen over the last year and a half. Coming up in our next hour, we're going to take you alongside those nurses on the front line who you saw in that video there to find out what they're still facing, the impact it's having on home, and the one thing they say we can all do to help.
And that's really concerning, hearing that some nurses are now leaving.
Yeah, and there's already a nursing shortage in this country. We've been taking a look at that really over the last 6 months or so. We're going to focus in on more of that coming up in the next hour as well, hearing from that nurse manager with Community Health and Community Hospital South.
Yeah, inside the ICU, powerful story.